minimize or reduce the side effects of the chemotherapy by taking your food as your medicine. So this is a chart which is showing the different type of the incidence of different type of cancers in pediatric age group, like lymphoid leukemia, acute and chronic type, and acute and chronic myeloid leukemias, Hodgkin, non-Hodgkin lymphomas, brain tumors, and neuroblastoma, nephroblastoma, hepatoma, and then the list goes on. Like my colleague Dr. Huma just has mentioned that there are different type of chemotherapies, like cytotoxic therapy, immunotherapy, targeted therapy, hormonal therapies. Similarly, there are different ways to give these therapies also, like IV, intrathecally, oral, or injectables. So always remember that the chemotherapy never comes alone. It is always going to bring a lot of side effects also with it. So once a patient once a patient decides that he's going to take chemotherapy, then he should be prepared for all the side effects that is going to face also with this therapy. So like once the chemotherapy is started, patient may have general fatigue, they have hair loss or eyebrow loss because of iron deficiency, anemia, multiple skin changes like dermatitis, eczemas, or scaly dryness of skin because of vitamin A, vitamin D, and zinc deficiencies. They may have abnormal immune system also because of the, like doctor said, neutropenia, and then they need a lot of expensive injections like filgrastim, or for low HB, they need to have a lot of red blood cells transfusions and a platelet transfusion. So all these things can be addressed and can be minimized if we will take proper, healthy, completely nutritionally dense diet, because diet has a major role in overcoming all the side effects. Because once you start chemotherapy, one should know that the chemotherapy is not only going to target your cancer cells, it is also going to affect your normal healthy cells. As a result, you are going to deplete a lot of nutrition from your body. You're going to deplete a lot of micronutrients from vitamins and minerals from your body. So you need to have to replace all of them via your diet. So the common physical side effects could be fatigue, nausea, vomiting, hair loss, blood count changes, GI problems like bloating, constipation, diarrhea, mouth sores, metallic taste because of the side effects of the medications, ulcers, then peripheral neuropathies, numbness, tingling in the hand and feet because of B112 deficiencies, then sleep disorders. So there are a lot of complications which comes with chemotherapy. So now the question arises how we can manage and how we can overcome these side effects of chemo medicines, and how to prevent the depletion of these micronutrients by taking proper, healthy, good diet. First of all, we should remember that the nutrition requirement of a growing child is completely different from an adult man, because the growing child does not only have to fight with the injection with the cancer itself. He has to gain body muscle mass. Also, he needs to gain his height. Also, he needs to have his cognitive development. Also, motor, psychosocial, motor, and cognitive development matters a lot in a child case. So one should remember that the growing child has completely different nutrition requirements as compared to the adult one. So children on chemotherapy requires high caloric, high protein diet with a high amount of good fatty acids in the diet. The diet should contain small meals, because the child is having very small capacity of their stomach. They are not going to tolerate a lot of huge heavy meals. So for that reason, you need to give them 2 to 3 small meals. Avoid snacking in between. The reason for that is once you start giving frequent meals like every 2 to 3 hours, thinking that a patient is having cancer and his metabolic demand is too much, the body will take a lot of time in digesting that particular food instead of healing time. So we need to check this healing time along with this dietary digestion time. So we need to give 2 to 3 meals to a child. Make sure that whatever food you are giving to a child, it should be HDD. HDD means high density diet. How you can prepare high density diet at home means if you are giving a bowl of a food to your child, then it should contain all forms of complex carbohydrates. It can have potatoes, it can have sweet potato, cabbage, meat, mutton, beef, fish, eggs, anything, lentils, beans, vegetables, this capsicum, carrots, peas. So this whole bowl of the whole bowl of food will be completely dense, and it will contain all kinds of complex carbohydrates, proteins, amino acids, both essential, non-essential, and all the micronutrients. So even if a child is going to have few bites, 2 to 3 bites from that bowl of food, then he is going to have all his complete calorie requirement. Then similarly, you need to have good amount of proteins, like good quality of eggs, fish, beef, and mutton, and everything, so that if there be protein content will be there, and so that there'll be more good good response, good immune system, and the baby will be able to fight with the infections on its own. Now comes the hydration. Hydration is very much important in children because of the diarrheas and loose motions, and sometimes the children are reluctant to feed. Also, they are not able to swallow because of mucositis, and then glossitis, ileosis, and then they have got mouth ulcers, and a number of medication they have got metallic taste, and they cause also mouth ulceration. So most of the children, if they are unable to swallow, or they are unable to take plain blend water, then you can offer them coconut milk, coconut water, almond milk. Coconut milk and water itself works as a medicine. Why? Because it has got a lot of nutrition. All the electrolytes are there, all the minerals are there. It helps in gut lining healing as well. It reduces the inflammation also. So if a child is unable to take plain water, you can offer them coconut milk, coconut water. You can offer them lassi also, both the sweetened and the saltish one. Sweetened, yes, you can use raw honey. You can use the paste of figs and paste of dates instead of giving processed sugars, sugary items. Do not offer a lot of juices and milkshakes and fruit juices like that coming in the packets and containing a lot of food, artificial colors and foods and preservatives and a lot of sugars. You can always offer them detox water, preparing at home by adding banana, by adding let's say strawberries, apples, and lemons, turmeric, ginger, and making this water is going to absorb all the water minerals from the fruit itself inside the water, and then you can offer this water to a child, so that child can able to take a few sips of this water. In this way, he is going to take his nutrition as well as he will be hydrated well. Now, coming on to the sleep works like magic. Why? Because it fights, and during our sleep, our fight and flight mechanism gets switched off. As a result, the cortisol level comes down, and the growth hormone and the thyroid hormone, which are very crucial for the child's growth and physical and mental development, they goes up. So a child with the having chemotherapy should have at least 9 to 10 hours of good proper quality sleep, deep sleep. As a result, the body starts gaining his stem cells. Renewal system. The body will start repairing itself. During sleep, your body repairs itself. So make sure to have proper good night sleep. Then it comes sunlight exposure. Why? There are multiple studies showing that those children who were deficient in vitamin D levels, or their vitamin D levels were not sufficient, they were more prone for having different sort of cancers, even leukemias and lymphomas. So if a child is having cancer and he is receiving chemotherapy, so vitamin D is already depleting from their body. So you need to expose them in the sunlight at least 1 hour in the morning time, 1 hour in the evening time, so that while gaining vitamin D levels, and then receiving vitamin D supplements also, which are which are available in market easily, so that you can improve the vitamin D status. Because once vitamin D is stabilized, your body will have a good immune system. Why? Because your vitamin D also acts as an immunomodulator. So good form of vitamin D in the form of a sunlight will help to absorb other minerals also, like calcium, magnesium, vitamin K2 also. So now, coming on to the macro and micronutrients, similarly, like our colleague said before, carbohydrates, carbohydrate, proteins, and fats all matters a lot. Good Instead of taking gluten and starchy diets like breads and pastas and Maggi noodles and so many other sort of lasagnas and things like that, instead of giving that thing, you can use good quality of millets like kudu millets, pearl millets. You can have jawar, jawar, bajra, which are easily available in Pakistan and all around the world. You can use barley as well, and bajra, to make roti and chapati, instead of giving them gluten, because there are many multiple studies saying that the gluten's wheat and these are highly processed, and they are sprayed with glyphosate, which is again another cause for colon cancer and other form of cancers. So try to avoid that. And then come micronutrients like vitamin A, D, E, K, and other minerals. Bone broth. Bone broth is a very effective and very nutritionally dense thing, because it contains a lot of collagen itself, which helps to repair your leaky gut and which helps to repair your enterocytes in your gut lining, the cells of your gut lining, colon, and intestine. So bone broth is very effective because it contains high amount of collagen, amount of glutamine, glycine, all the essential amino acids you can get from the bone broth. Doesn't make any difference if it is coming from beef, mutton, or lamb, or chicken. But bone broth, 1 cup a day, and 1 cup or 2 cup a day will help your child to gain his all the micronutrient deficiencies to overcome. Now, better to avoid, always counsel your parents that avoid all packets food that are coming and filled with artificial flavors, monosodium glutamates, and colors and food additives. Although these food additives, they do increase the shelf life of the food which is available outside in the market, but they are not going to give the nutrition that your child requires for a better, for cancer fight and for better growth. So, how to overcome other nutritional deficiencies while on chemotherapy? We call this one replacement therapy. Why? Because you need to replace all the unhealthy things with the good healthy things. Like, for example, instead of using oils, processed oils, canola oil, sunflower oils, you can always use olive oil, avocado oil, or replace them with the ghee, because the ghee that you make at home from the cow's milk is not having a strong aroma. You can use ghee also, because it is going to give all the essential fatty acids to your child. Similarly, eggs having good quality of vitamin A in the egg yolk also, they are fatty acids. So give good quality of eggs and dairy products. Similarly, consider this one, like small meals is always less is more. Why? Because when you are giving small amount of meals to your child will be having more time to digest that feed. The body will try to gain a lot of try to extract a lot of nutrients from that small meals, but it should be high density again. Then, because of the deficiency of iron, the child should be on a good iron containing diet. Iron is present in beetroots, iron is present in beef and red meat. Iron is also present in leafy vegetables, and then red beans also, like rajma and lobia. Similarly, vitamin A, D, E, K. Vitamin A is there in eggs, and then vitamin D is there in your dairy products and sunlight, and vitamin E is in there sunflower seeds. A lot of vitamin K is there in green leafy vegetables. In Pakistan, we have got a lot of green leafy vegetables like sarson, saag, bathu. A lot of stuff is there. So if you can prepare these things with the beef and mutton and chicken, and by enhance, as doctor said, that you can enhance the aroma and the flavor seasoning, so that the food should not be bland, it should be tasteful, so the child will easily be able to accept the food. Similarly, you can give them the sweetened, instead of giving them packet biscuit chips, and instead of giving them packet chocolates and candy bars. So by you better to give them granola bars making at home, by adding a lot of like a peanuts and peanuts seeds, like a sesame seed, walnuts, almonds, and then blending all the seeds with honey, figs, and dates, which are easily available all over. So you can blend these things and you can make the bars out of them, and then you can give them, instead of asking your child to munch, or they'll have snacking on chips packets or something like that. They can always take makhanas also. Makhanas are lotus seed, which is very healthy and having high content of calcium also. This way they can have their calcium requirement also fulfilled. Similarly, instead, if the child is not able to take raw milk like that, or packet milk, which is tetra pack, which is also not that effective, so better to uh, switch them to on almond milk, or something like that, coconut milk, which is very nutritive dense also, and having good flavors also. You can always add honey or fig paste or date paste in foods to make them sweeten. This way their density will also increase, the food quality will also improve, and the child will be able to gain more nutrition with small amount of food. Now come the folate and B1, B9. Again, green leafy vegetables have a folate and vitamin B12. Vitamin B1 is there in beans and lentils and legumes. In Pakistan and India and other Sri Lanka and other agriculture countries, they have got a lot of good quality of not polished one, the lentils and legumes and beans. So one should also can have beans, lentil soups like hummus and things like that. A child can prepare all these things, mothers can prepare all these things, and then they can give them to their child by adding some uh, bone broths also in them. Then comes selenium. There are a lot of seeds also, hemp seed and other seeds, Brazil nuts and other nuts also, and even in almonds and cashew nuts, which are available there. So we can have all these nutrients from the diet as well. Then, if the child is having constipation, you can give them high fiber diet. If the child is having diarrhea, you can give them pre-probiotics. And then for adding quality to your food, you can always add olive oil on the top, and if the child is losing its weight, you can add ghee on the top of the food, so that the food is or more palatable. And if the child is not tolerating anything of them, you can add avocado oils, or you can always give them steamed food, grilled food, or baked food. This way they will be able to take small quantity of food, but completely nutritional dense. In this way you can replace all their micronutrient deficiencies. You can help them gaining weight. You can help them by giving good amount of omega-3 in the form of fish and cod liver fish oil. This thing you can these things will help him in growing proper cognitive development, and help in physical and mental growth. Thank you.
Thank you, Dr. Farheen, for sharing those valuable insights. Dr. Lateef Khatak, you may start
Welcome.
now.
Assalamu alaikum. My screen is visible.
Yes, it's visible.
Okay. Bismillah Rahman Rahim. Thank you, Science International, and especially Malaka, for inviting me for this beautiful uh, collection of students and experts on the topic of cancer and nutritional management of the chemotherapy side effects. As earlier, my two colleagues, Ma'am Farheen and Dr. Huma, they both brilliantly explained in very much detail. So I will not go into details. It will be just a repetition of that. Uh, Before going to start my presentation, I would like to uh, inform all of the students and colleagues here that Science International is very soon going to start its own research journal. And one important and good news is that for students, the research publications and this international journal, which will be recognized with HAC and foreign bodies, will be totally free of cost. And at the same time, we have started 5 stages cancer research, which one of the stage one of that research has been conducted in my native district Karak. And in the coming month, inshallah, we are going to start our stage two in the cancer in the name of cancer trends and KPK. Stage three of that research project will be conducted on national level with the trends of cancers in Pakistan, and the stage four of that research study will be cancer trends study in South Asia, and the final stage will be conducted as a comparative research study of the cancer trends of South Asia, Pakistan, in context with Gulf countries. In this research study, we are collaborative partner with Qatar, government of Qatar, and Brazil Cancer Institute UAE, and one of the university and Ministry of Health KSA, inshallah. So most of the things are being explained by Dr. Huma Nakib, as she is very much with practical experience in nutritional oncology, being student and uh, expert at Rogat Khanam Memorial Hospital, and same was the case with Dr. Fareen. She brilliantly explained the causes, etiology, science, and symptoms, and also she touched in very detail the nutritional management of chemotherapy based side effects. I will not take much more time of you because it will be just a repetition of these things. But I would like to add some 5 types of food items which should be considered while we are managing as nutritionists or as physicians. We are treating a patient who is undergone for chemotherapy or radiotherapy. So we will have to consider 5 type of diet in our treatment plan. Number one is high protein food, which is very much essential for tissue repair and immunity. That protein help build cells damaged by chemotherapy. It's aimed for 1.2 to 2 grams per kg of body weight daily is its requirements. We can get this high protein foods from eggs, dairy products, poultry, and lean meats and fish. Plant-based options, we have lentils, beans, tofu, and maced diets if needed. And with that, we have nuts and seeds like almonds, walnuts, peanuts, butter, smooth ground flax seeds, uh, just to add for smoothies or yogurts. And the second food item we have is easy to digest blend foods, which is very much good for nausea and vomiting control, which is a common side effect of chemotherapy. These settle the stomach and are less likely to trigger the nausea. It can be done with bananas, rice, toast, and plain crackers, or dry toast, or boiled or mashed potatoes, and pastas, gingers, uh, gingers mixed in fresh waters, and clear broths and weak herbal teas. And the third food item which we can have is soft and moist food, which is very much helpful for mouth sores or dry mouths, which is uh, very much common side effect of chemotherapy. We have mouth ulcerations, which can be we can choose cool, smooth textures to avoid irritation of the oral mucosa. Due to ulcer, the smoothies and milkshakes can be given as blend yogurt, banana milk, and nut butters. and mashed potatoes with butter or gravy can be done. Yogurt, custards, puddings, and ice creams can be used to which can be helpful for mouth sores and dry mouth during chemotherapy. And scrambled eggs, cottage cheese, or soups can be used in this regard. The fourth food items group we can have is high calorie diet to prevent weight loss and boost energy. During chemotherapy, we face severe weight loss, which can be controlled, which can be tackled down with high calorie diet. And these two meals snacks to increase calories without eating more volumes. Healthy fats can be given. Full fat dairy, cheese, sour cream, whole milk can be given. Dried fruits of apricots in small amounts or soaked amount can be given. Honey or butter, toast, and cereals can be given to the patient to rise its energy, to boost the energy, and to give him high calorie intake just to combat the weight loss and energy degradation. And the fifth one, food section which can be very much helpful is food for specific side effects. Like if some patient have, with side effects of chemotherapy having diarrhea, we would go for banana, rice, and boiled potatoes, and yogurts with probiotics, and will avoid raw high fiber foods initially. And if the patient is facing constipation, then we will go for juices and stewed prunes, cooked fruits and vegetable oats, and plenty of fluids will be given. And one important thing, if the patient for chemotherapy is facing constipation, we will apply the warm water as drinking water in his diet, and will increase fiber gradually in his diet. Uh, the third option we can face is low appetite or fatigue. Nutrient dense snacks like Greek yogurt with honey, peanut butter, or cracker cheese and crackers or nutritional shakes can be given to combat the low appetite or fatigue of the patient during chemotherapy. The other important thing is low immunity. Stick to well cooked foods, avoid raw salads, unpasteurized items, or street foods, as Dr. Farheen explained in detail about these things. The general encouraged food categories are fruits, vegetable, carbohydrates,
सॉरी टू इंटरप्ट यू सर
vitamins.
बट पीपीटी स्टक है तो उसको ठीक कर दे
Sorry.
पीपीटी स्टक तो उसको ठीक कर दे
Okay, sorry. Okay, okay. So most of the points were explained by Dr. Farheen and Dr. Huma. I'm not repeating these things. And the practical tips for these things while combating the side effects of chemotherapy as nutrition expert is to prepare meals when you feel better and freeze portions, and make food appealing and mild flavors are served attractively, and use nutritional supplementations that will aid good points to your health. And in the last, finally, I will discuss the 15 important nutrition tips uh, which should be given to the patient while you are treating him as dietitian or nutritionist. Number one is just advise the patient to stay hydrated. Number two, to eat small, frequent meals. Number three is focus on proteins. Number four is choose nutrient dense foods. Number five is the limitation of processed food, just to limit the processed food. Number six is consider soft food in diet plans. Number seven is stay away from strong odors. Number eight is the incorporation of healthy fats in the diet. Number nine is monitoring of nutritional supplementations. And number 10 is to manage food safety. Number 11 is the limitation of sugar in salts, just to control the glycemic index and hypertension and blood pressure levels. Number 12 is the use of flavor enhancers. Number 13 is the practical mindful eating. Number 14 is the consultation with a dietitian. And number 15, the last one, is listen to your body to understand that nutritional needs may change during treatment. So it's crucial to be flexible and responsive to your body signals. So this is something about nutrition management. Uh, of chemotherapy side effects, which were in some way you can say that it was just a repetition of Ma'am Farheen and Ma'am Huma. Thank you very much. It's from my side. Any question? We are here.
Thank you, Dr. Latif, for providing such a clear and thoughtful look into nutritional management in chemotherapy. Now, if anyone have questions, they can raise hand or unmute their mics or put them in chat box. Laiba Gul has asked what type of cancer is at the greatest risk of malnutrition, according to experience of instructors, and requires more critical approach.
As far as pediatric, sorry, shall I answer?
Yes, of course.
Yeah. Actually, it depends on the child. If a patient is having, like, most of the time, what we have seen, if a patient is having acquired or chronic lymphoid leukemias or lymphomas or any other, even the brain tumors also. If a child is having brain tumor or brain cancer like that, and so as a result, the child is most of the time having fits or unconscious, or they are the one on NG tube or TPN. So as a result, they are the one more at the risk, right? If the child is not that completely conscious. But sometimes it happens, like, if, even for leukemias and lymphomas, if a child is able to eat, but because of the mood changes and repeated episodes of coming to the hospitals and then repeated cannulations, sometimes they are too much irritable, even though they are not having any kind of glossitis or chiliosis. So their mental status also matters. So what I think is that it depends, it varies from patient to patient, that it's not like, obviously, if a colon cancer is there in adults, the colon cancer is more common. Similarly, so like, if a child is having celiac disease and then he is developing this colon cancer or other lymphomas or something like that, this is another case. But mostly, if a child is having only blood cancer like leukemia, lymphomas, Hodgkin and non-Hodgkin lymphoma, they are eating well. But because of their irritability or other side effect, then they do not eat. But those who are having any CNS related issues, brain tumors, then they are the one, if they are having seizures or they are on NG tube or something like that, only then they are the one more critical to manage their nutritional requirement.
Okay, thank you. I want to add something. And along with all of this, yes, you are very clearly mentioned. So the head and neck cancers, including C esophagus, when the patient undergoing for the PAC tubes, those patient, and for the colorectal upper GI cancer and lower GI cancer. In the GI lower cancer, the gastric and the colorectal cancers are very more prone towards the development of the malnutrition during their active cancer treatment. Thank you.
Thank you, Dr. Homa and Farheen. Another question is that what is more effective food type for child suffering from GI cancer?
What for pediatric age group you're asking? Hello?
Yes, ma'am.
Yes, she's.
Hmm.
I think high protein food are the most important one, which they are asking about when the child is suffering from gastrointestinal cancers. Rest, Dr. Farhini will explain in detail.
Exactly. If a child is having any kind of GI cancers, then obviously they need high protein diet. Why? Because उनको repair के लिए, enterocytes की repair के लिए उनको high protein चाहिए होता है. Similarly, जिस तरह अगर colon cancers हैं, तो इसमें काफी दफा there are studies there which are in favor of bone broth, because bone broth has got collagen. Colon cancers usually कब होते हैं? When there is leaky gut, और जो हमारे enterocytes हैं, उनके अंदर जो बीच में gap junctions हैं, they become broad, and as a result, multiple type of nutrients they are leaking from the gut itself. सो एज अ रिजल्ट उनको डाइट देने से, जिसमें बोन ब्रॉथ के अंदर बहुत मैक्सिमम कोलेजन एंड प्रोटीन्स हैं, सारे ग्लूटामिन है, ग्लाइसिन है, जो उसको रिपेयर करने के लिए काम आता है. तो यस, जितने भी कोलोन कैंसर्स हैं, उनके अंदर बोन ब्रॉथ और हाई प्रोटीन डाइट का बहुत ज़्यादा इफेक्टिव रोल है.
Okay, thank you, Dr. Farheen. We have short time, so एक और question है तो उसको जल्दी से answer कर दीजिए. Are there any malnutrition screening protocols followed in Pakistan for cancer patients?
यस, इसमें हमारे
यस।
पास जी जी
जी जी मैम। जी जी मैम,
जी जी
हम आप।
इसमें हमारे पास सब्जेक्टिव एसजीए जो है सब्जेक्टिव ग्लोबल असेसमेंट्स है। इसमें हम करंट वेट लॉस की हिस्ट्री, डाइटरी इनटेक, एनी चेंज इन द डाइटरी इनटेक, इसमें कोई जीआई सिम्टम्स, बायोकेमिकल असेसमेंट्स बेस्ड ऑन देयर बीएमआई फॉर एज या वेट, जो भी हो तो हम असेसमेंट कर लेते हैं। उसके बाद हम वी हैव कैटेगोरिकली कैटेगराइज देम एज वेल नरिश्ड, अंडर वेट, और जो भी मेल नरिश की कैटेगरीज में ले आते हैं। और फिर वो इसी तरह जिस तरह मैंने एनसीपी मॉडल के बारे में बताया था, इसी तरह फिर हम उसके डायग्नोज और इनकी इंटरवेंशन करते हैं। प्लीज़ डॉक्टर लतीफ़, प्लीज़ आप भी एक्सप्लेन कर दें। और
यस
बाकी
मैम।
माल न्यूट्रिशन असेसमेंट टूल्स भी है, और डिफरेंट टाइप्स ऑफ जो स्क्रीनिंग टूल्स हम इस्तेमाल करते हैं बच्चों के लिए।
मैम
एडल्ट्स के लिए भी है हमारे पास, ये एसजीए भी है, बहुत फॉर एल्डरली पॉपुलेशन के लिए हम मिनी असेसमेंट टूल एमएनए जो है वो उसका इस्तेमाल करते हैं।
जी बिल्कुल मैम, हम IMM यूज करते हैं, CMM यूज करते हैं, इंटीग्रेटेड मैनेजमेंट ऑफ एक्यूट मेल न्यूट्रिशन और कम्युनिटी बेस्ड मैनेजमेंट ऑफ एक्यूट मेल न्यूट्रिशन, जो कि नेशनल प्रोटोकॉल है पाकिस्तान में स्क्रीनिंग ऑफ मेल न्यूट्रिशन के हवाले से।
CMAM and CMAM, I guess, right?
यस मैम, इंटीग्रेटेड कम्युनिटी बेस्ड मैनेजमेंट।
Hmm. There is one question I would like to answer if Dr. Latif and Dr. Huma allows. There is
जी जी मैम, जी
Labagul,
जी मैम,
but
प्लीज गो
how
अहेड।
will the adult GI cancer patients will be able to tolerate high protein diet if we give them chicken, beef, or lamb kebab like that? Lambs, mutton, right? So, yes, the question arises this one कि अगर हम इनको हाई प्रोटीन डाइट देते हैं जिसमें बीफ एंड चिकन है, हाई प्रोटीन डाइट का मतलब ये नहीं होता कि आप उनको पूरा एक बकरा खिला दें या पूरी गाय खिला दें। उसमें आप क्या करते हैं कि जो प्रोटीन डाइट देते हैं आप उसमें उसके अंदर जो आपने चिकन लिया है या बीफ लिया है, मटन लिया है, उसमें आप उनको 1 से 2 स्लोली एंड ग्रेजुअली, हर पेशेंट का टॉलरेंस लेवल डिफरेंट होता है एज कम्पेयर टू अदर वन। सो अगर आप उनको चिकन का कबाब दे दिए, यू कैन ऐड अ लॉट ऑफ वेजिटेबल्स ऑल्सो इनसाइड दैट। अगर उनको ब्लोटिंग नहीं, यू कैन ऐड कैप्सिकम डालते हैं, प्याज डालते हैं, उसके बाद फिर एंड देन यू विल मेक द कबाब आउट ऑफ देम। देन ऑब्वियसली अगर एक कबाब देके देखें, इफ दे आर एबल टू टॉलरेट, उसमें स्पाइस लेवल बहुत कम रखें ताकि उनको किसी भी किस्म का जो है वो ज़्यादा स्पाइसी ना लगे, उनका मेटाबॉलिक सिस्टम जो है बहुत ज़्यादा स्पाइसी फूड टॉलरेट नहीं कर सकता। अगर कबाब है उनको फ्राई मत करें, उनको ग्रिल कर दें, उनको बेक कर दें। इवन चारकोल बारबेक्यू भी नहीं करना चाहिए बिकॉज चारकोल ऑल्सो कॉजेज अ लॉट ऑफ issues in the gut. So what you can do is that अगर आप कोई भी patient है and he wants to eat some kebabs or something like that, even chicken बोटी या beef का कुछ भी चीज़ tolerate करता है तो उसको start from a very smaller quantity, 1 से 2 बोटी start करें, 1 से 2 small size of kebab start करें, and then you can slowly and gradually see the response, because हर patient का हर चीज़ के लिए there are a lot of food allergies also out there which are again a leading cause of cancers also. So if the patient is already having some kind of protein allergy, तो हो सकता है कि वो काउ बीफ मोटीन को रिजेक्ट कर दे, उसका सिस्टम उसको एक्सेप्ट ही ना करे। कुछ को डायरिया हो जाता है, कुछ को कॉन्स्टिपेशन हो जाता है, किसी को कोई जनरल कंडीशन रैश वैश हो जाता है, राइट। अगर आपका पेशेंट जो है वो छोटे छोटे चीजों में चंक्स ऑफ प्रोटीन जो है वो क्या कहते हैं टॉलरेट कर रहा है, देन वेल एंड गुड, देन स्लोली एंड ग्रेजुअली यू कैन इंक्रीज द अमाउंट। अगर आप दिन में एक दफा देके देखें या अगर दोबारा स्टार्ट रीफिलिंग दोबारा स्टार्ट कर रहे हैं तो वह ऑल्टरनेट डेज पे देके देखें, एंड देन एक डेली देके देखें, फिर 1 से 2 दफा देके देखें, एंड देन सी हाउ इट गोज। बट येस, यू कैन ऑलवेज ट्राई विद द स्मॉल क्वांटिटीज।
Thank you, Dr. Farheen. Okay, we will wrap up this session, and I would like to thank you to all respected speakers on behalf of CAB platform, our CAB coordinator, and on behalf of Sir Ataur Rahman. We are very grateful for your valuable insights and amazing knowledge. If you have found today's session helpful, I would encourage you to fill feedback form in the given in the chat box. We would appreciate your rating of this experience and would like to hear your remarks. To get certificates, kindly fill quiz form in the chat box. We are constantly organizing such webinars and providing resources that turn awareness into action. So we would really appreciate if you stay connected to this platform and follow all socials through links provided in the chat box. I would once again thank you to all our honorable guests, our respected mentor and CEO of CAP, for their time and value provided, and for such a warm audience in making this webinar filled with knowledge and awareness. Thank you for your time.
Thank you, Jazakallah. Thank you so much.
Thank you
Yeah.
all.
Thank you.